25 things you should never do during the coronavirus pandemic. 1. Don't forget to wash your hands. This is the most important protection against COVID-19. Wash your hands after being out in public, after you use the bathroom, after coughing or sneezing, and before preparing or consuming food, basically, as often as is practical. 2. Don't wash your hands for less than 20 seconds. 3. Always wash your hands with soap. 4. Don't sneeze or cough openly. Cough or sneeze into the crook of your elbow, some call it the Batman sneeze, or into a disposable tissue. 5. Don't touch your face. Germs are most often introduced into our body when we touch our eyes, nose or mouth, experts say. 6. Don't touch door handles. Coronavirus can live for 2 to 3 days on hard surfaces like door handles. That's why it's especially important to wash your hands regularly, and push doors with your arm or elbow when possible. 7. Adhere to social distancing recommendations. Social distancing guidelines come from a place of knowledge. They've prevented other novel viruses from exacting an even greater toll. 8. Don't attend large gatherings. 9. Don't go to restaurants and bars. 10. Don't shake hands, not to encourage antisocial behavior, but now's a good time to substitute a handshake for a wave or an elbow bump. 11. Don't hoard face masks. 12. Don't hoard food. There's no need to panic buy food. Officials from around the US and world have said there is no shortage in the food supply, and grocery stores will be restocked. 13. Don't panic. Be prepared, be vigilant, be informed. But don't be panicked. We will get through this together, even if we have to remain apart temporarily. 14. Then again, don't think you're immune. At the same time, now isn't the time to be complacent. If you're young, you can still develop COVID-19 and serious complications. Millennials are being hospitalized, and spread coronavirus to more vulnerable people, like the elderly and immunocompromised, even if you're symptom-free. 15. Don't go to an ER unless you're seriously ill. If you have COVID-19 symptoms, it's best to call your healthcare provider for advice. Don't go to an ER unless you're having trouble breathing, you might infect others there. 16. Don't drink too much alcohol. Drinking too much can raise blood pressure and reduce immunity, two factors that could make you more susceptible to COVID-19 and complications. 17. Don't sleep less. Sleep is a time when our immune system recharges. Aim for 7 to 9 hours a night. 18. Don't let anxiety take over. If you're feeling anxious, turn off the news and social media. Breathe deeply for a few minutes. Practice techniques that reduce anxiety and stress, including mindfulness, meditation, and exercise. 19. Don't stop exercising. Even though gyms may be closed in your area, daily exercise is key to staying healthy. Luckily, working out at home is easier than ever, thanks to apps and sites like Beachbody, OpenFit, Active, and Fitbod. Several gym chains have online workouts too. 20. Don't eat poorly. Stress eating could turn COVID-19 into the new version of the freshman 15. Don't let it, that will only compromise your overall health. 21. Don't share bogus information. We all want our friends, loved ones and community to stay informed about COVID-19, but make sure any information you share comes from major news sources, hospitals and health organizations like the CDC and WHO. 22. Don't avoid nature. Going outside during social distancing is more than okay. It's a good idea, the Johns Hopkins doctors said. Just keep your distance from others. Walking, hiking, and biking are good. Contact sports are a no-no. Exercise is physically and mentally important, especially in stressful times. 23. Self-quarantine if you suspect you've been exposed. This is key to slowing the spread of the virus, experts say. Follow your healthcare provider's instructions. 24. Self-isolate if you suspect you've been infected. If you're ill with COVID-19, it's important to occupy a separate bedroom from other members of your family if you can, and avoid sharing towels, bedding, glasses, plates, and silverware until you're recovered. 25. Don't follow the rumor mill. Don't concentrate on speculation or rumors, and unfortunately, a lot of news reports right now are one, the other, or both. Focus on facts about COVID-19, how it spreads, how serious it is, and where we are by reading the latest updates on the CDC and WHO websites.